I am Matt Ellefson, founder of Survive It, and we're back today to talk again with Dr. Chad Rusthoven about radiation treatments. Another thing that I felt as a patient, and I think a lot of other patients maybe feel the same way, is when we receive radiation or when we receive any treatment, as far as that goes, we want to see if it's working. We want to see if it's working like tomorrow. I mean, we want to know right away if this is working or not, because otherwise, why should we continue on with this treatment? And when in fact, my first line of therapy, I didn't have another scan for several months until the end of that initial protocol, which I was in a clinical trial. At the very end of that protocol, that trial, then I had a scan. And the whole time I was wondering, this is crazy. I mean, why? How do I know if it's working or not? And so can you help explain that a little bit to patients as to why you do things that way, how you know whether the radiation treatment is being effective, and when is the appropriate time to check, and what intervals would you recommend having scans to make sure that your treatment was effective?
Yeah, it's a great question. It's a question that I get asked so frequently that when I first meet a patient, I talk to them about this as just part of my routine discussion. I'm usually the one bringing it up, and I tell them I won't know how effective the radiation is going to be while you're receiving it, and I won't be able to even evaluate that until usually several months after the treatment is over. And I feel like that's a really important thing to tell patients because it's only human nature. You're going through all of these steps, showing up for multiple radiation treatments. You may be having side effects. You're anxious about the cancer, the prognosis. You have a million things going through your head. It's very natural to wonder if all of it is worth it. So what I tell people is that even in a patient where let's create a hypothetical patient where they are destined to have the radiation work perfectly, and it's going to get rid of the cancer in whatever area that we're treating, and the cancer in that spot's never going to come back, and they're going to do great. Even in that patient, while they're going through treatment, you usually can't see much of a change in the size of the tumor on a scan. It actually takes time, and usually several months, before you see tumors start to shrink appreciably and begin this slow process on scans of going from what's consistent with a tumor to something that's consistent with fibrosis or scar tissue left behind from the eradication of a tumor with radiation. That can look different in different organs. Things that are treated in the brain look a little bit different than things that are treated in the lung and versus other organs. But for most things, it does take time for the body to start to remove dead cancer cells and for those scans to change. So the real issue is that our scans are just not sensitive enough in 2018 to give patients a good understanding of whether or not the treatment is working perfectly in their case while they're going through it. And the very unsatisfying thing about cancer surveillance is that it's the test of time so often, where we have to get scans periodically, sometimes for years. And in each of those situations, it's a no news is good news situation, where we're hoping for the absence of anything suspicious. And that is a very unsatisfying position for patients to be in. Absolutely. It would be so much better if we could just do a blood test or a scan right after treatment that would give us a definitive answer that the treatment had worked. But unfortunately, that doesn't exist yet. And hopefully someday it will. But for many situations, what we're looking for is the predictable evolution of treatment-related changes, where oftentimes, round, bulky looking tumors start to become smaller, start to become almost stretched out and look more band-like and like scar tissue. And that complete evolution, depending on what you're treating, can sometimes take months or even years. So as the radiation oncologist, what we know going in is, based on usually high level evidence, randomized trials and things like that, that a certain amount of radiation is known to produce tumor control at a certain rate. And usually we're trying to go for the highest rate of control we can and limiting side effects. And we know what that number is, number of treatments, total radiation dose, based on clinical trials. And so that's the standard dose, and we're trying to deliver that dose to achieve those known results in the patient that we have in front of us. So after we've prescribed the amount of radiation dose and we've done all the kind of behind the scenes work to design a radiation plan, in large part, my job really becomes a supporter for the patient to help get them through the prescribed treatment, to respond to their symptoms and their questions, and to help them get through this treatment that we believe is necessary to give them a high rate of tumor control. So that's really what the radiation oncologist's job becomes during the treatment. It's not usually to evaluate for treatment response, but it's really to support the patient and get them through side effects. And then we know that, it doesn't usually, in most cases, do anything but cause anxiety if you get a scan too early, because you won't have allowed enough time to see the tumor response. Even in patients who are destined to have great responses, if you get a scan too early, you still see something there that's trying to move towards becoming a treated tumor, and you can cause a lot of anxiety for the patients because you looked too early before you could really see the benefits of the treatment. And then the second part of your question was, how do you know how often to get scans and things like that? So that is that's highly variable. The way that we think about that is different for different cancers and different stages and different applications. But for a lot of those things, there are pretty good guidelines that doctors follow that give you an understanding of how often you get those scans. And sometimes that might be, they might change, but things like every 2 or 3 months or 4 months for the first year, and then spreading things out thereafter is a common thing that's seen in a lot of different tumor types, but they can vary quite a bit from situation to situation.
Excellent explanation of that. Thank you. That's all for this segment of Fearless Fridays. We hope it was informative to you. It certainly was to me. And I just want to remind everyone that no matter what questions you may have or concerns that you may have, always feel free to contact us at info.surviveit.org, and we will do our best to help you. Until next time, I'm Matt Ellefson. Stay strong and live fearless.